Good afternoon, everyone, and welcome to the YWCA Racial Justice Lunch and Learn series. I'm Leah Merritt, President and CEO of YWCA Mahoning Valley. Our goal is to bring you lunch and learn events with speakers, book reviews, and featured community partnerships focused on racial justice. The YWCA has been on the forefront of racial equity and social justice work for a very long time. Eliminating racism and empowering women are not just words, they are our mission, especially where it comes to the intersectionality of gender and race. We hear the disparate statistics and poor outcomes of people of color. However, it's the women of color who are the most impacted. And then we must focus here first to solve racism. Thank you to our sponsor, the Martini Martin Arts Foundation. And today we are excited to hear from Lisa McDuffie regarding her work on the Toledo Black Agenda. Before I formally introduce Lisa today, some housekeeping tips. This is a Zoom webinar, so you're all muted and off camera except for the speakers. But we encourage you to use the chat and the feature to enter your comments and questions for Lisa or the YWCA Mahoning Valley. We want to know where everyone's joining us from here today, so please enter that in the chat now if you have not. And we want to thank you all for attending, especially on a day off for many of you. It's a federal holiday, and so we do appreciate your time. I know many of you are already doing the impactful work of social justice, and we are all collectively working towards peace, justice, freedom, and dignity for all through this work. So now on to learn a little bit about our speaker. I've known Lisa through the YWCA for some time, and her vision and persistence are invigorating. I've enjoyed working alongside of her and learning from her. She is truly a fearless leader, and I am so proud to know her and call her a sister in the fight for justice. Working until justice just is. Her formal bio is very impressive. Lisa is the president and CEO of the YWCA of Northwest Ohio, and that's centered in Toledo area, and has been a part of the agency for 25 years. Mrs. McDuffie oversees a $5 million budget, 20 county service area, and staff strength of nearly 100 employees. Lisa's most recent accomplishment has been the startup of a new domestic violence transitional house that can house 16 women. Those doors opened in February of 2018, but in 2010, Lisa orchestrated new construction, a $10 million apartment complex that houses formerly homeless women and children. Lisa, together with a 20-member board of directors, ensure the empowerment of women and the elimination of racism is addressed in all mission-based YWCA programs, such as the Domestic Violence Shelter, Hope Rape Crisis Center, Youth Development, Teen Pregnancy Prevention, Child Care Resource Referral, and the Healthy Connections Breast Cancer Awareness Program. The agency also has a strong advocacy arm that has led the community efforts in March's voter registration and Power to the Polls, legislative outreach, and dialogue to change a curriculum geared to discuss issues of racism in America. Mrs. McDuffie has a master's in science and social administration from Case Western Reserve University and a bachelor's degree in social work from Findlay College, and is a licensed independent social worker with supervision status by the state of Ohio. Lisa has been extremely active on various boards and committees, such as the governor's appointment to the Ohio Children's Trust Fund, member of the ProMedica Board of Trustees, board member connecting kids to meals, board member of CareNet, health equity chair for Healthy Lucas County, chair of the Lucas County Prevention Council to End Child Abuse, treasurer of the Ohio Council of YWCAs, member of the Lucas County Parking Authority Board, campaign chair of the Lucas County Domestic Violence Task Force, Metro Parks board member, just to name a few. I don't know where she gets the time. And she's also an active member of the Toledo chapter of the Lynx Incorporated, Alpha Kappa Alpha Sorority Incorporated, Zonto Toledo Club, and the Downtown Rotary. She has been married to her husband, George, for 31 years and has 2 adult children, daughters, Victoria and Brittany. And I know we have a small video before Lisa speaks, so we'll turn over to that now. Welcome, Lisa.
The death of George Floyd ignited something in people. It created a level of sensitivity, a level of awareness, a level of responsibility, a level of inspiration, a level of courage.
He was not the only reason the Unification Coalition was brought together, but he, in his murder, really was the catalyst.
There are some systemic issues around every organization and institution.
So it started off with 100 years of chattel slavery, followed by brutal Reconstruction, then Jim Crow laws, and then the racism that we see today.
The civil rights movement happened 100 years off of the abolishment of slavery, and then we're just 60 years away from our civil rights movement. And in a lot of cases, we're still in that fight and in that struggle.
He said, I need no defense for my people because history has shown that they are equal to absolutely everyone else if they are given an equal chance at this life.
My philosophy is none of us are totally innocent and none totally guilty. Now let's get to work.
We need everyone to be working together, Black, brown, allies.
What better time than now?
Now is the time.
There's no better time than now.
This is the time.
And if we get tired, we need to say,
Breonna Taylor.
we need to say Trayvon, we need to say
George Floyd.
And it is time to unite our collective voices and push for change.
Good afternoon. I just want to do a quick sound check to make sure I'm coming in loud and clear. Leah, can you give me a thumbs up?
I can say yes.
All right. Thank you, thank you, thank you. It shows a little different on my screen today. Well, good afternoon, everyone. It is definitely a pleasure to be able to join you here today. I first want to recognize Leah and the wonderful work of Mahoning Valley and the opportunity to come and just share a little bit about the Toledo Black Agenda, as well as what the YWCA of Northwest Ohio is doing. Boy, every time I see that video, it gives me chills for several reasons. One, because it was a pretty special time that African Americans, leaders in our community, had the opportunity to come together and really unite and move toward collective energy. Let me just tell you real briefly how we came to be. Next slide, please. One night, right after the horrific death of George Floyd, I tossed and turned for a couple of reasons. Obviously, because I too was totally taken back by what I had seen on TV, to see a man lie under another individual's knee for 8 minutes and 26 seconds. But I also was moved as a person of color. All too often, things happen that take us back. And the next morning, with very little sleep, I immediately got on the phone and reached out to a few of my colleagues and said, you know, we need to do something. We are leaders in this community. We are well respected in a variety of different settings. And I'm not sure if you heard, but the Toledo City Council, as well as our Lucas County commissioners, actually declared racism a public health crisis just the night before. And it was new news. This wonderful gesture that our public officials made was almost swept away and in the dark. And having the opportunity to, one, share with people that Toledo Lucas County had decided to make racism a public health crisis was commendable in itself. But what is more important than words on the paper is the action that comes behind it. And so I asked them to join alongside of me to invite as many leaders as you could to a Zoom call. And just 2 days later, more than 40 leaders showed up on this call. We needed to check in to make sure we were okay. Those of you who are watching this, I'm sure you can appreciate it saying it is not really easy to walk into several settings and be our authentic selves. There are times that we must mask what we feel because there are times that we believe we carry the weight of the race on our shoulders. So despite what was happening, we had to keep the faith. And so getting together on that Zoom call gave us an opportunity to do that check-in. There's something called weathering that I believe is very, very true in terms of stress. And after we checked in, it was then and then literally that we said, how can we unite and make a collective voice? Right then and there, without hesitation, the Unification Coalition was established. We knew we needed to answer racism as a public health crisis. It's not our problem, but it is our solution to make sure we give practical steps to our community on what they need to do for the Black community. So that is exactly what the Toledo Black Agenda is. It is our manifesto that gives you steps of what you need to know about racism and various recommendations and various pillars of what needs to really be addressed. We thought it would be important, extremely important, to establish rules moving forward. We came from all walks of life. We were as diverse in age as we were in occupation. We wanted people that were radical and some that were very conservative. We wanted representation from all disciplines, knowing that all of us really wore our hearts on our sleeves. And knowing that you brought really that type of diversity to the room, it was so important to make sure we established the rules going forward. Anybody and everybody was welcome to our table with one precedent. They needed to be Black. We decided that we would write the story for the Black community on behalf of the Black community. We decided that decisions would be made in tandem, that there would be majority rule in terms of positioning. And then we set out to really discover what we needed to do next. Next slide, please. So we needed to, one, make sure, as I mentioned before, that the words that were as important as they were on the paper, that we told our public officials in our community that the words alone were not enough. In doing so, we needed to be able to go through a series of exercises that made sure we were on the same page with what racism as a public health crisis is. On the slide is a definition that really just kind of speaks to that. Next slide, please. So when we start to talk about what is a public health crisis and relate it back to racism, it is very, very simple. This is not a Lisa McDuffie definition. This is Otto Webster. This is Wikipedia. This is all of the trusted sources that you can Google. Anything that reflects significant impacts on a community's health, okay? We're gonna cover this in just a minute. It's life expectancy and the economy. All those things together equal structural racism. And that's why racism as a public health crisis. Next slide, please. So our exercise really started around issues of what needs to be gone. If we imagine a world without racism, what wouldn't be in it? And once we were able to identify those things, we brainstormed, we then compartmentalized, and then we came up with our pillars. It was a long but very good process. It gave us really an opportunity to see who was bubbling up as natural leaders. And it also gave us really strong insight on who else needed to be at our table. So the rules after we brainstormed and acknowledged what needed to be gone, identified what needed to change, identified headings, we then said, it's now time for us to identify the leaders. We wanted subject matter experts, and in most cases, we got that. In a few cases, we actually got individuals that were just passionate and had long experiences in the various topics, and we were fine with that. Because the next assignment then was to form your subcommittee and populate it again with others that aren't on the unification large table and begin to work. Part of what we needed to do, and this was known upfront, is make sure that everything in our manifesto was factual. There are no opinions. We wanted to make sure that no one could dispute it. And the best way to do that is to do a little research. So on a national level, what does statistics tell us about the criminal justice system, the economic justice, education, so on and so forth? And then let's look at our state. What are the statistics that represent health, inequity, and housing and workforce? And then let's try to string it all the way through to our local community. Next slide, please. So let me begin. We can spend our entire 25 minutes talking about each and every one of these topics. We know and understand how complex and detailed they are. But what I want to do for you today is just give you just a glimpse of some of the information that we needed to cover. For the criminal justice system, it was so important to talk about the history. We know that Black people have long suffered at the hands of law enforcement. We know that there were slave patrols and night watches that later became modern day police departments. And they both were designed to control Black people. When slave codes and patrols ended, new laws were formed, and they were called Black codes. These codes dictated how, when, and where Black people could work and how much they were to be paid. They also restricted Black voting rights. They dictated how and where Black people could travel and where they could live. Sound familiar? These Black codes were then replaced by the Jim Crow laws. They controlled Black people and focused on the rejection of their civil rights. For nearly 80 years, the Jim Crow laws mandated separate public spaces for Blacks and whites, such as schools, libraries, water fountains, and restaurants. And anyone who broke those laws or violated the social norms, such as talking back, looking at a white person directly in their eyes, often endured police brutality. If we go on and even keep talking about the criminal justice system, it is so very important to know, again, what the numbers tell us. Numbers tell us that law enforcement today is allowed to racial profile. There was a mention in our report that spoke to our own Toledo Police Department and how they have a non-bias policy that is allowed. They went on and they talked about all the wonderful right things. But then as we dug in the report, what we did see is racial profiling is not allowed, but they are allowed to stop based on suspicion. And so if they are suspicious of an individual, the law allows police officers to stop people. When we start thinking about driving while Black, jogging while Black, even sleeping while Black, all of the things that equal stops and even the arrests after a person has been stopped immediately puts them into the criminal justice system. You know, in terms of statistics, we know that Black people are 5 times more likely to be stopped without just cause than white people. Fatal police violence is the 6th leading cause of death for men between the ages of 25 and 29 across all racial groups. But despite the fact that white people have been killed by police, Black people are disproportionately impacted. While white people make up a little over 60% of the population, they only make up 41% of fatal shootings. Black people make up 13% of the population, but they make up 22% of the fatal police shootings. You know, in our quest to make sure the numbers were there, we spent time talking about the criminal justice system. We spent time talking about mass incarceration. And we also wanted to make sure that people really understood that there's no predisposition that makes Black people more criminal-minded than any other race. But when you get to the heart of really the inequities that exist for criminal justice, it all ties back to racial justice and the mere fact that police officers have a mentality, they have a training regime that allows them to stop individuals on the mere fact of suspicion. And so if there is a fear-based tactic, we already know that the outcome for people of color just is not a positive one. Our report goes on and talks about 24 recommendations that we made for our community. I won't get into the recommendations just so I'll have time to get to some of the other reports. Next slide, please. Right, so now we're going to go to education. And it looks like a few of my notes are a little bit out of order, but that's okay because we're going to move right on through. But education, in terms of the historical context, we already know that in many of our southern states, even the ability to read and write and be taught things were illegal. That we already know that Black people were not given the same liberties to be taught and to even advance so that they would have an opportunity to live even outside of you know, being able to be free. And in this historical context, we go on to explain how important it is to make sure that we look at, in particular, our youth today and their need to have access to good quality education, to have access to teachers that are non-biased, that already we know that there is a need for training and unconscious bias really seminars on an ongoing basis. This is not a one and done. It is something that is extremely important that must be shared all throughout the course of the school experience. We know that statistically on a national level, Black kids are experiencing suspension and expulsions at higher rates than any other race. And so when you start thinking about what history has told us and you tie it together with the data, our report goes on to tell you just how difficult it is in our community to be a student of Toledo Public Schools. We know their budget is not what it needs to be. We know that there are certain systems that are in place that make it almost impossible to feel comfortable in an environment of learning. And some of that is the presence of Toledo police in our schools. Our numbers were quite telling. It talked really, really firmly about the need to be able to begin education at an earlier age, and that universal pre-K for our community is a must. It came out to be one of the major recommendations from the perspective of knowing that that head start, that early start, allows kids to enter kindergarten ready. And so our community is a little behind the times. There are many other of our counties in Ohio that have already implemented universal pre-K. And we came out very strongly saying we demand that our community follow suit. But in addition to that, we also are requiring our schools to take a hard, fast look at making sure they are culturally competent and are covering the history the way it really needs to be. We know that this is something that just Lucas County alone cannot carry that heavy pail. So it is something that definitely needs to be done on a statewide level. But it's important that kids are empowered and feel good about their educational experience. And in doing so, it starts with our babies all the way up into higher education. Next slide, please. The healthcare equity, boy, this was a big, heavy lift. Our committee spent a lot of time really talking about the historical context of health equity. We already know that African Americans tip the scale when it comes to chronic diseases and our death rates. We already know that we have the highest incidences of diabetes and hypertension. And of course, the pandemic has made things considerably worse. But we also look at the fact that social determinants of health are critical in making sure that Black people have access to not only healthcare, but they have access to quality care. It talks about food deserts and food insecurity. It talks about myths that still exist, and some of them, quite frankly, aren't myths. They are true stories that some of our healthcare professionals need racial justice training and unconscious bias training to be able to really help bridge the gap from the historical context to where we are today. And so our report takes the time to talk about numbers and statistics, and it also pushes one's mind that it is interesting that now, as a result of what's happened with George Floyd, that all of the attention is now on health disparity. We're not complaining about it, but it's been this way for years. And now, up until this very moment, no one seemed to care. So our report blatantly puts that out. We provide recommendations that link not only to healthcare providers, but also those trusted individuals that need to come in and make sure they are there as advocates for individuals that really need access to quality healthcare. We do talk about an empowerment model for Black people who also need to take control of their lives. For the longest, we know that our voices have been silenced. And so after a while, you begin to internalize some of those things. You may not believe what the doctor is saying to you. You may not even understand it, but you don't speak up and question it. There may be things that we know we need to eat, but because there's not a grocery store in our area, or we have issues of transportation, we fall back on what's close, and that's a fast food restaurant or that's a corner store. We bring all of that to the forefront and really make some strong recommendations that if we indeed care about our community, it has to include a lens of racial equity, even for our brothers and sisters of color. One of the things that I'll add right here, we were in the midst of the pandemic, obviously, but now that the vaccine has rolled out, one of the things that is critically important for people to think about is how important it is to develop herd immunity. Well, guess what? You can't develop herd immunity without looking out for your Black and brown brothers and sisters. We too need the vaccine, but there are things that are in our way that are interfering with our trust and even with our interest in getting the vaccination. So we've got to take time to make sure that our messaging is good, that our outreach is connected to the message of the importance of the vaccine. Make sure that we are working to dispel myths. And this is one of those things that even if our white brothers and sisters didn't care, they have to care now if they too want to live and be able to beat this virus. So that's just an extra recommendation that would be thrown in had we still been working on this document. Next slide, please. Housing is another one of those pillars that speaks directly to the heart of policies and procedures that deliberately held Black brothers and sisters down. We talked about redlining, we talked about the GI Bill and the ability to purchase a home, and we talked about in our community, the majority of Black people are renters. There is a very, very small percentage of homeowners, and those reasons are quite vast. In a while, we'll talk about the economic impact, we'll talk about the wealth gap, and the mere fact that there have always been, and sometimes are, rules in place, policies in place that prohibit Black people from acquiring housing. From banks to mortgage companies, even landlords and individuals selling their homes. And as a result of it, many Black people have been forced into this notion of renting or living in subpar housing. Our recommendations in this pillar, again, really addressed all the issues that I talked about. And most importantly, it pushed our private sector to do right by Black and brown people. We are looking for all types of mortgages and economic advantages that would allow us to also own our homes. Next slide, please. Workforce and the wage gap. It was extremely important for us to talk about just the varying degrees of difference in how working and a minimum wage job, or working even in some instances in a setting where you would believe the salary would be comparable with the education. There were statistics we found on a national level that talked about the wage gap and the fact that Black people were owning a little over 63 cents to the dollar of a counterpart white person. It talked about the fact that even in today's time in our wonderful country, that Black people may have a college degree, but earn less than a white person with no degree. Those are statistics that can't be changed. And when we also begin to think about climbing the economic ladder of workforce, we can't ignore the fact that our corporate, our C-suite representation is extremely low. We know already that the culture in the workplace is created by the CEO and those senior staff. And in order to be able to embrace diversity, in order to be able to really uproot racist tendencies, it takes not only the CEO and the C-suite and the senior staff to be all on board, but it takes a total review of policies and procedures. It takes a review of any of those informal rules that are in place that govern the hiring and the promotion of people. Our recommendations here were really, really simple, and it's really put your money where your mouth is. It was pretty blatant for us that we want audits in our private sector. We want the ability to have a pipeline to economic prosperity, and that begins with workforce. When you tie it all together, the economic impact with the health, with the criminal justice system, again, all paints to racial injustice. Next slide, please. And so here we have it, our definition of systemic racism. And for me, it is important to know that it is very different than just racial prejudice, hatred, or discrimination, but it is systemic. It is built in our very policies and our practices that govern and shape cultural beliefs and values. It is in every single sector and fabric of our country. It's in my community, and my assumption is it is also in yours. Next slide, please. So in our report, there were any list and number of solutions. And I want to begin just this segment talking about some of the obvious. The solution to addressing systemic racism has to go beyond a corporate statement. The statements are nice. I applaud all the businesses and corporations post George Floyd that came out denouncing it. But it takes more than just a statement. The solution to systemic racism goes beyond a seminar, even beyond a couple of webinars. It also goes beyond concentrating in just one pillar. We know it's complex, we know it, we live through it, but if you fix housing and leave education broken, it's not gonna work. If you even begin to look at health inequity and do nothing with the workforce pillar, you've also missed the boat. It's all of these pillars working together that begins to dismantle racism. It begins to allow Black and brown individuals who have been trapped by oppressions to begin to then be on a level playing field. And a solution, my friends, is going beyond just being a good person. You know, we hear that often. You know, we believe that racism is only something that people that have white sheets and hoods in their closets or run around college courses, campuses carrying tiki torches. But racism does indeed live with our good white brothers and sisters that may be social workers or doctors, be in a helping profession, but have unconscious bias. They follow procedures and policies, sometimes unintentionally, sometimes oppressing and causing harm. And for those individuals who are good, intentionally good, we're here to tell you that it takes time, and we know it takes time, because for many years that you've been alive, chances are you have read in your textbooks, you've been told by your Aunt Jean or your Uncle Bob things about people of color. And your own experiences, or the lack thereof, have formulated a thought in your mind, thinking errors they may be, but you have followed suit by following them and discriminated, and in some cases oppressed. So we need those good people to, one, take a deep breath and realize that I too may be a racist, but you do not have to stay one. You do not have to stay one. Attending webinars like this is one of your first steps to being on your road to developing your equity muscle and becoming an ally to help dismantle all forms of racism. It goes beyond having a few friends of color, and the $1 million point is it goes beyond hiring people of color. Hiring people of color alone will not do it. It's like having a party, being invited to the party, but never being asked to dance. It is important that you set your culture and your atmosphere right, that you have a culture of belonging and inclusivity. So we want to be invited to the party, but we want to help plan it. We want to help pick the music, the band, and even the menu. That's what being an ally is all about. Next slide, please. And so in conclusion, I want to very proudly tell you that thanks to the work of our Unification Coalition and the Toledo Black Agenda, our community is now behind the scenes forming something we have named the Toledo Equity Inclusion Council. This work will be housed at our YWCA. We've created our mission and our vision. We will have 3 co-chairs. I will be one. Another gentleman representing our private sector will join me, and another woman who represents our public sector or our funders will join. Our ability to co-chair TEIC will then be supported by a consultant that we will be engaging to help us review what we already have in terms of data, all of our reports, our strategies, our comprehensive plans, and then be able to populate each one of our pillars that I've just named with working work groups, all diverse, of people of color, as well as our white allies, businesses, and private partners. And together, we will decide what course of action we're going to take in each of our pillars. It's really exciting. We're planning to line up our funding to center around this very goal of inclusion and diversity. Everything we do as a community, we've agreed that we will do it through a lens of racial equity. And I believe this is really the start of a change for a better, more improved, equitable Toledo. I'll be happy to take any questions. I'll turn it back over to you, Leah.
Wow, Lisa, that was amazing. Congratulations on your work. It's I'm sure been a fast and furious journey, and I'm glad that you're able to continue moving that forward. And I guess just, to follow up, some people might say, well, geez, I'm an ally, I'm a white person, I'm not a bad person, and I want to help. So thank you for explaining the reason that it was so important for you to have that safe space. And for those white allies, please don't be offended by this work, because at the end of the day, you don't have to worry if you were picked up for speeding because you were Black or white, or, you may not have been followed through the store as a suspect of, for stealing. And so just please keep that in mind when doing this work.
Yeah,
So
I totally agree, Leah. Totally agree. The mere fact that they have joined the webinar, we're pleased to have you. And, at our YW, we really have a saying that we take people where they are. And it takes really coming out and coming forward and being in a space where you are prepared for vulnerability. We know that there are racist actors out there, but racism is much bigger than them. This is about dismantling systems and policies that in some cases were really birthed by our government. So it is bigger than the one individual. We need all allies and accomplices to join us in this fight.
And that's so true. I mean, every day I find something that challenges me to a new level that I didn't think about before. It's sometimes just thinking of things in a different perspective. And we've been very fortunate with our Ohio Council of YWCAs, really pushing us forward. Margaret Mitchell spearheading that for racism as a public health crisis. And, we've been promoting that locally, statewide, and nationally. On those agendas. And we have a few coalitions here in the Mahoning Valley that are helping us move forward, declaring that. Some of our cities, Youngstown and Warren, have made that declaration, and some of the counties are also trying to move forward. And I wanted to kind of bring some perspective to that today, and we reached out to a couple allies doing this work. One was not able to be here, and that's through our Trumbull County Combined Health District. And they've created a racial health disparity subcommittee composed of community stakeholders and members, providing feedback to make necessary adjustments and eliminate racial disparities in Trumbull County. And they've identified that based on their community health assessment in 19, and I'm sure this is no surprise, that it was discovered that your zip code and your race determine your length of life, and could be dramatically lesser than the average age of those residents. And of course, the COVID-19 added just another level of that. So they provided some more information on that, but basically, if you're interested in joining, you can call Jenna Armini at the Trumbull Health Department, and her number is 330-675-7807. But we do have another guest here today, Michelle Edison, and she's a wonderful force of nature in her own right, and she's the Director of Health Equity Strategies and the Initiative for Mahoning County Public Health. And Michelle has been instrumental in spearheading the work of the Mahoning Anti-Racism, Justice, and Inclusion Coalition, or as we like to call it, MAGIC. She's currently a Doctor of Public Health student of Health Equity and Social Justice and the school-wide Doctor of Public Health programs at the John Hopkins Bloomberg School of Public Health. So we'd like to welcome Michelle here. And Michelle, do you see parallels in our communities based on the Toledo Black Agenda?
Absolutely. And first of all, I just want to thank the YWCA of the Mahoning Valley and across the state for really being such a light in this work. The work that you're doing, Leah and Lisa, is really inspiring. And I'm honored to be here today to share this space with you. And I'm very excited because, like Lisa and Toledo, we were also moved and inspired to come together collectively to determine what can we do, because we know something needs to be done. And so again, very shortly after the murder of George Floyd and some of the statewide declarations of racism as a public health crisis, I was inspired to send out an email to just a few folks, Leah included, to say, what's up? What are we gonna do? And so for the past 6+ months, we have been convening together leaders and stakeholders and entities that have been doing this work around health equity for years, and some that are new to this work, to come to the point of, let's develop a comprehensive strategy. Let's put our money where our mouth is, so to speak, and let's actually take some action. So with the MAGIC team, what we really talked a lot about was supporting each other and the efforts that are already in place, and the ability to strengthen those efforts, to connect and collectively have a synergistic approach to improving outcomes for our communities. And so you will see that not only is the county health department involved, but Youngstown City and YWCA and Healthy Community Partnership, which is a collective impact group, and on. And again, open to anyone who is really inspired to do this work and is doing this work. And so when we look at equity across the board, there's not a lot of differences. Those pillars that Lisa talked about are very real in all of our communities. And so our approaches might be different, but the impacts are the same. And so I so appreciate the work that Toledo has done in laying out a strategy and really identifying those areas that need to be addressed, right? When we talk about health equity, so for me as a public health professional, I know and I see that it's not just getting to the doctor, because if you don't even have transportation, you can't get to the doctor to have that assessment to determine what else is going on. And so it sort of snowballs, right? And we're now beginning to make those connections. Another thing is that, I really appreciate the building of relationships as well. And so when we talk about our allies in this space, we know that if we all do better, we all do better. And so again, I really appreciate the fact that the incidences of 2020 have in a way given us the opportunity and perhaps permission to address equity, health disparities in a way that we weren't able to do before.
Thank you, Michelle. That's great to hear. And if people want to get involved, how can they reach out?
Yes, absolutely. We will. We're working on developing ways to communicate with MAGIC. We're not quite in the same space that Toledo is in. We're actually beginning to work with a consultant to help guide some of those strategies, even as our coalitions works together and figures out the best way to support each other. But at this point, anyone who might be interested can contact me at the Mahoning County Public Health, at my email address. You can email hub@mahoninghealth.org, and we would love to get you involved in what we are really excited to be doing.
Thank you. We do have a few questions. I'm not sure, I guess this is for both. Which funders have been engaged, and in what capacity are they supporting this incredibly important work?
So for us in Toledo, it's going to be a hodgepodge type of an answer. When we first started the Toledo Black Agenda process, it was done not in behind the scenes on purpose, but because it was open only for Black people, the good majority of us believed we needed to do it without attaching ourselves to any of our funding sources. So this was done purely voluntarily. After we released the document, put the video together that you saw, was all done pro bono. In fact, by a very young but very talented African-American male in our community that has his own business. It got a lot of attention, and indeed, people did begin to throw money at us. And we will gladly take that money. And so we have heard from some of our banks, some of our major corporations, but I think really to answer the question in such a way that I think the person is asking the question, now that we have moved beyond announcing a plan through this Toledo Black Agenda, who's coming to the table? And so let me answer it from that perspective. Toledo Equity Inclusion Council, that is newly formed, is coming together really with the support of our major health system, one of our banks, and also our city government. And so the consultant's fee will be covered by those corporations and those businesses. And then for each of the work groups, we believe populating it with public and private citizens, businesses, and corporations will also follow suit in terms of dollars. After we release the agenda, the Toledo Black Agenda, we had over 40 businesses sign up, just, I want to say chopping at the bit, waiting and willing to jump in. And we just said, give us just a minute and let us develop a structure to kind of formalize this a little bit. So it's a long version of hopefully answering that question.
Thank you. Michelle, want to speak to that?
Yeah, and for us, again, we are sort of just beginning to formalize our efforts. But what I really appreciate is that those that have been involved in these discussions in MAGIC for the past 6 months, probably 24 individuals have really committed to this work. And so whether it's time, whether it's future funding, resources, everyone has committed to support this. And so I think that that's going to really help us in the long run, right? Because we all have our networks that we can tap into for this work. So we are definitely looking for future opportunities as we become more formalized. But right now, just that commitment, I think, is crucial for us in really making progress.
Great. Here's a question about what are your success metrics and how will you measure progress towards that?
Yeah, for us, we actually are hoping our consultant can really help lay that out for us. We are committed to results-based accountability and being able to make sure we have a good system in place that's going to really tell us what we know the data needs to prove to everyone else to know that this is effective. I do want to just also include one other little piece. Our city, through the support of the mayor, has actually funded a diversity study. And the main purpose for that is for a group to come in and really assess how we really are doing in terms of women-owned businesses, minority-owned businesses, and whether or not the city should support initiatives to really promote those type of ventures. It needed to be done. And, there were some folks even in our community that questioned that. It's like, why are we wasting money? We know we need it. Well, the fact of the matter is, it is one of the smartest things and one of the most supported things that the city of Toledo could do. It allows researchers to come in and document the need. And once the need is documented, then the dollars will follow the need. And it's a way to avoid lawsuits. It's a way to avoid those folks who may be saying, what is the city doing, setting up a pipeline program for minorities? Well, the proof will be in the data. And so, again, our goal is to be able to roll all that out at the same time.
I love that very scientific approach, just the facts only. There's really no disputing that. And it really gives you a great basis. We have a question about, did you experience a lot of pushback from the city or other partners during the process of the Toledo Black Agenda?
Actually, we did not. The city has been one of our partners from the very beginning. I didn't mention this in detail, but a good portion of the individuals who are listed as contributors to the docket come from a variety of different jobs. Some are in city government, some are in county government, our major corporations, as well as our healthcare industry. But some of those individuals were sitting at our table as an individual. And so in the very beginning, when we made decisions, how we would list ourselves was one of those things. And so I am really pleased to tell you that the good majority of those folks who were at the table were comfortable lending their name to the document, but that wasn't the case for all. There were some who very clearly knew if their name showed up on the document, what life would be like for them back in their place of employment. And so it was a collective decision to list people individually as opposed to by company. But I am really pleased that our city is actually the fourth entity that has come to support the Toledo Equity Inclusion Council.
Great. We have a lot of kudos in the chat box. Thank you so much. We do have a social worker who wants to know how they can be a better ally and do more, and they're also appointed to their diversity committee. Any tips for this participant?
Do you want me to take that one, Michelle? Go.
Yeah, I think in the work that we're doing here, a lot of our focus has been around community health workers, engaging the community, bringing that sort of realness to our work and building those bridges. And I think the same can be done with social workers. I think to your point of engaging in workshops and trainings and doing those self-assessments, I think is crucial. We had at the end of, I believe it was 2019, we did a home visiting, a bias workshop with our community health workers and other home visitors, again, to identify some of those areas of improvement so that we can connect with the community and provide services that are appropriate and encouraging and uplifting to those who need it. So I think that that's one way to participate, and obviously being on that diversity board is a huge step. We need those voices, the voices of those that you serve and work with, and bringing those to different councils and committees. We're always encouraging our community health workers to do presentations like this, to be on boards, to have their voice heard, and also the voice of those that they serve as well.
And I would just add, I wouldn't be a director of a YWCA and not be able to say this, but on our website, and I'm sure this is probably the case for Leah, our YWCA in Toledo has a list of resources, various books and podcasts that I would encourage you to just peruse and see if there's something that jumps out at you. In just a few days, most YWCAs across our country will be participating in something called the 21-day Racial Justice Equity Challenge. And again, it will be full of rich resources that, again, will really build your equity muscle and, again, further position you to be a good ally in this space.
That's a great way to wrap it up. We do want to promote the 21-day challenge. So thank you, Lisa, for helping us do that. There's a slide being shown now how you can register with that each day for 21 days. You get content direct to your inbox that you can read whenever you want, whether that's 3 o'clock in the morning, which I've gotten emails from Lisa at that time of the morning. So we know people are up, whatever works for you, but just really that 21 days is how long it takes to change a habit. And this allows you to be mindful and thoughtful throughout that process of building your skills on becoming an ally. So I just, sorry we can't get to all of our questions today, but we do appreciate your time, Lisa and Michelle, and all of you for attending. Please make sure to sign up for the challenge, check out those resources, and enjoy the rest of your day. And we will be sending out a survey tomorrow, and please complete that so we can get your feedback and bring you more content.
Thank you.
Thanks, everyone.